You know, over the years, if you've watched The Time of Your Life, you know that one of the things that I keep telling all of our viewers is, as you grow older, I'd rather see you wear out than rust out. Well, what does that mean? We don't want you just kind of sitting around and getting rust on your body, but we do want you to wear out because of the fact you've used that body. That's the good news. Well, but sometimes as you're using that body, some of the parts can kind of get a little bit of wear on them, and they maybe need to be looked at and even sometimes replaced. My guest is Dr. Hussein Turk, and you are an orthopedic surgeon. You're specializing in from here up.
Hair up, exactly.
From the hand area up. And today we want to talk about shoulders, because a lot of my buddies are out there and they're golfers, and all of a sudden, Dr. Turk, they're telling me, they're telling me my shoulder's not working right. What happens to your shoulder as you age?
Well, a lot of these people who are out there playing golf and stuff were athletes when they were younger. So whether they knew about maybe having a dislocation or just kind of wear and tear, the ball and socket, that's the shoulder, starts to get a little kind of, think about a smooth joint, think about a smooth ball bearing, you're getting a little grout and some dirt and dust in there. And that's what can cause some what we call shoulder arthritis. And there's different kinds of arthritis. There's arthritis that keeps the surrounding soft tissues intact, and then there's arthritis where the surrounding rotator cuff muscles and tendons are no longer functioning correctly. So you can actually get pain. You can get pain with loss of motion, or you can actually just get pure loss of motion too. All these things, depending on your age, can all be treated with certain what we call joint replacements. Okay, and a lot of these things are just a function of age, right? A lot of them are. A lot of them, I mean, you can have post-traumatic, which means if you actually had an injury there, or you could have degenerative arthritis. Okay, so in other words, if a person was a little younger, might have been a football player, took a few hits, and it doesn't show signs until they get older. Correct. And that's when the arthritis starts to come in there. Absolutely, absolutely. Okay. So then normally what would happen is they're feeling the pain, they go to their general practice doctor, then they would be referred to you, would they not? Correct. Oftentimes they're complaining if they couldn't, pain at night, it wakes them up at night, it's a deep searing pain to the back of their shoulder, and they'll go see their general care physician, and they'll get an x-ray, and then they'll notice that there's really no more space between the two bones. They're rubbing on each other, and that's where they get referred over to us. Okay, and at that point, normally, if it's at that point, physical therapy, is it? Well, the big thing is loss of motion. As we kind of, like I mentioned, just think of a ball bearing. You want it smooth. As you start getting that kind of dust and pebbles in there, you start to lose that full motion. So physical therapy can help you keep the motion, but it really may not help with the pain. Okay, so it would just it's gonna ease it for the time being. Yeah. But long run, you still have the problem internally there, right? Correct. Okay, so then the next step would be surgery. Well, I think surgery is always the last step. We can try some anti-inflammatories, try medications. Just see if you can put up with this as long as you can, because these replacements don't ever last forever. So about maybe they give you maybe 10 or 15 years. So we always want to kind of hold off until the patient says, you know what, I've done everything I can, and I really can't take this anymore. And that's when we can try to help them out. Okay. And the surgery obviously would be to do something with the shoulder to get it smooth again. Right. In other words, you're going to try to remove some of the causes of the problem in there. Absolutely. Like we do in a hip replacement where you put a ball and you put some plastic in there. For the shoulder, you do the exact same thing. You put a metal implant and then a plastic socket. And that's what we use for a normal shoulder replacement. And then for patients, for certain subclassifications of patients, there's something called the reverse shoulder, where we actually switch the ball and socket components around. And again, that's mainly for patients without a rotator cuff. So it can be very, very satisfying procedure. So it can work at that point. Normally, when you have this procedure done, obviously you have to go to an operating room to do it. Is there a long period of time that you're hospitalized afterwards? Not really. Usually a day or two. Okay, and then do you then go to physical therapy? Actually, we just let you go home, and then we don't really start you on therapy aggressively for about 4 to 6 weeks. Okay. Maybe do just a little light therapy, maybe once a week or so, but a lot of it you're just doing at home on your own. Okay, so when you're home after this happens, then basically it's just adjusting itself, is it not, at that point? Well, it's just kind of healing in is what it is, because the metal, actually all the metal that we have nowadays allows for bone to ingrow into the metal. So we just wait for the first few weeks for that to happen. That's great. So is there anything that we can do, or you can tell our viewers to say, well, guys, if you'll just
exercise more now or use it in more? Can we prevent this from happening?
Well, the biggest thing is you really can't prevent arthritis. Once it gets going,
Okay.
arthritis keeps going. But we really want is the tissue around there to stay flexible and stay strong.
Right.
Because the stronger you are when we start, the stronger you are you will be when we're done. So that just requires a little less therapy afterwards if we do need to do a shoulder replacement.
Well, good. Well, we appreciate that. And just remember, as Dr. Turk said, that when you're having some kind of a problem in this area, it normally happens by arthritis. Anything that you know that ends in itis usually means an inflammation thereof, and it can cause lots of pain. And we'll be right back right after this.